I think it's going to become much more integrated than it is, and by that I mean that the various subspecialties like anatomical pathology, biochemistry, genetics, etc., are all going to come together more closely to really enhance the way that we treat patients and we make the diagnosis. And I think this is because of the enablement that genetics brings. And for example, if you do, say, a whole genome sequence on a person, you have an idea of not only what the cause might be of their presenting condition to the hospital. They may have come in with a cardiac arrhythmia or epilepsy or something like that, but you also have an idea of other diseases that they may be at risk of developing in later life. And some of these, of course, can be extremely serious diseases, possibly resulting in sudden death, loss of consciousness while they're driving a car, and so on. So by being aware of what people might be at risk for, it gives us the potential to manage these conditions, and in an attempt to try and preferably prevent them occurring at all, but if they are going to occur, then trying to minimize the degree of severity of these disorders, and also importantly give us an eye on what tests we can use to predict when they are more likely to occur. And those tests might involve biochemical tests, they might involve looking at the person's blood profiles, and so on. So that's why I think it'll become much more integrated, that it'll become almost a seamless diagnostic front that we use to better manage a patient's existing disease, but also manage them into the future to optimize their state of health.